1 year today since the pandemic really began here in this country. We kind of marked that anniversary with a lot of mixed feelings. Obviously, Dr. Matt Howie's with us this morning. He's been working for that entire year and beyond, by the way, to help people, but specifically in the COVID area. He's in family medicine. He's also director of York City Bureau of Health, and he joins us here on WSBA Morning News with Gary Sutton. Good morning, Dr. Howie. How are you?
Hey, good morning. I'm doing well. Hey, I just really quick. I am the medical director.
Medical director. I'm sorry. I'm elevating you past your means, right? So, but the medical director, yeah. And I want to make sure I get that right in all seriousness. But a year today, boy, your memory must be going through thousands and thousands of things over this past year. What kind of strikes you?
I got to tell you, it's been impressive that you can sustain a response. And when I say response, I'm talking about the entire community response over that time period. It's pretty extraordinary. We started out, we were talking about weeks to months, and now we're talking about, what is this emergent, post-acute phase that we're going to be dealing with when it comes to COVID. Pretty remarkable stuff, good or bad, good and bad, but pretty remarkable.
I'm looking at the CDC came out with some things this week and some pretty hopeful stuff. Their recommendations they came out with, you can visit with other fully vaccinated people indoors without wearing masks or physical distancing. You can visit with unvaccinated people from a single household or at low risk for severe COVID-19 disease indoors without wearing masks or physical distancing, and refrain from quarantine and testing following a known exposure if you're asymptomatic. So that sounds like pretty good news from where I'm sitting, Dr. Howie. Is it as good as I'm thinking it is?
It is. I mean, I thought I was waiting for the more cautious step, and I thought this was actually a pretty appropriate and solid step made forward by the CDC. They tend to be a little on the reserve side about letting things go, but it makes sense from what we're learning about the response to the vaccine after 2 weeks after completing the series, whether it's 1 or 2 shot series. They felt that the immune response is sufficient at that point that they can make this very good step forward for all of us. It all comes down to that high-risk individual, though, and that always makes me a little nervous because that's judgment for folks that have to say, is this kind of their own family pod, and truly are they isolated from others? That's kind of been moving forward a little bit. I think we've been kind of stretching our bounds even before this announcement.
Obviously, the bridle of COVID is still in our mouths, and there's a lot of people pulling back saying, not so fast, take it easy, calm down. The light's at the end of the tunnel, but it's maybe a little further down the tunnel than some of us think it is right now. How do you respond when, people said, hey, we're ready to go out and kind of throw caution to the wind and get out there and do all the things we normally do and get back to normalcy as we knew it before COVID came in? What are your thoughts? What's your cautionary thoughts about that?
Yeah, I go back to the numbers again. I think that we had a nice decrease for probably a 3-week period where we saw the numbers of cases going down. We've seen that improvement slow. So we're still seeing hospitalizations. We still have folks who are in the intensive care unit with COVID right now. And the positivity rate of number of positive tests, we've not gotten down below that 5%, which the state has kind of said is our kind of target we're shooting for. We're in the 8 to 10 range right now. Each week kind of coming down a little bit, but that rate of improvement has slowed down some. So we're not there yet. I think I said this last time. You can't spike the ball when you're on the 10-yard line. I was actually doing an interview, and I heard another doc say that, and I said that's exactly where we are. Football, we're not in the end zone. We're in the red zone, but we're not in the end zone. We got to keep doing what we know to do.
I was on vacation last week, and one of the numbers that jumped out at me, I was still kind of watching the news, and 73% down in cases since I think December 10th, if memory serves, which was incredible to me. I thought 73% down, but as you said, that still leaves 27% to go, or maybe not 27%, maybe 22% to go. I don't know. How do we look at it? What is the number that we're looking at here where we say, okay, we've achieved herd immunity, we've achieved a point where we can go maskless, or are we in a society now that maybe will continue to wear masks beyond, when this thing is really that dangerous? What are your thoughts about that, Dr. Howie?
Yeah, I mean, this gets into that, what is the post-COVID or the new COVID reality, the post-acute COVID, as it were. When we're not dealing with an outbreak in terms of a new virus into the community, but now it becomes endemic and it's moving around on its own, it's going to take on likely a seasonal component. We're definitely seeing that pattern now. So, come fall, are we going to talk about masks again? I think for folks open to masks, it's a really good idea. Other cultures have been doing it for years. It actually does reduce transmission of all respiratory viruses. We've had one of the lowest years for influenza this year that we've ever had in recent memory, and that's, I think, very much attributed to these same precautions. So that is going to be excellent for, I think, overall public health, as long as this is something that we can reasonably do that doesn't disrupt things. I think we're going to maybe be looking at, because of these viral mutations that are occurring and the different strains that are emerging, we're likely going to see an annual vaccine, not as complex a vaccine perhaps as the Moderna and the Pfizer, but something more in line with Johnson & Johnson, where we do an annual vaccine based on the strains that are most prominent. I could see that at least for the next couple of years until we really hopefully get this under wraps a little more completely.
What do you think about the new Johnson & Johnson vaccine that came out, Dr. Howie? Again, we're talking with Dr. Matthew Howie, a local physician here in York and medical director of the York City Bureau of Health. What do you think of that? And one of the complications that's come up, and it's kind of interesting, where ethics, I guess, meets science. They're talking about aborted fetuses, I guess stem cells used to make some of this. I'm sure you've seen some of that. Your thoughts on that this morning?
Yeah, I mean, this is when I take a look at that, and I do cringe a little bit, because I think that's something I think for the religious philosophers and ethicists to kind of, I think, debate. The amount of that's used is so negligible. I have a very hard time when I look on balance of the benefit for society. If this was our first vaccine, we would all be embracing it like nobody's business because of its remarkable ability to protect against disease compared to other vaccines that have led. The problem we had is we probably had the most effective vaccines that we've had in recent memory as the first two vaccines that came out with Moderna and Pfizer. And so it's paling a little bit in comparison, but in terms of its effectiveness as a vaccine, it's remarkably good. And I have no hesitation with its use.
You and I talked the last time we talked about this, I guess, associate doctor down at Johns Hopkins, who said we'll have herd immunity achieved by April 1st. Now, that may have been a little too rosy a picture, but do you have a sense at this particular point, and I'm not going to put you out on a limb too far, of when herd immunity will be achieved, if we're going on the same path that we're generally going on right now, although you say that's slowed just slightly? Your thoughts, about 45 seconds left.
Sure. I mean, I think herd immunity, we're approaching it. We're starting to see evidence of herd immunity in terms of these cases going down, but we're not there yet in the sense that improvement has slowed. We're going to be seeing herd immunity probably late spring, early summer. I think, and I defer to the folks, this is their area of research, and they're going to be wiser than I on it. But in terms of practically looking at numbers and trends, we need to get more significant vaccines into individuals, and that's going to take a little while longer. We're talking about sufficient vaccine by May at this point. I think it was the latest estimate. But when we get Johnson & Johnson product out more broadly, I think we're going to see that basically late spring, early summer. That and natural infection combined will likely get us to herd immunity then.
Dr. Howie, I always appreciate you taking the time to be with us, and always love your insights. We appreciate common sense on this, too, and thank you so much. We'll look forward to talking again very, very soon.
Thank you for having me. I appreciate it.
Thank you very much for joining us.